Hello, everyone. I'm Hartford Healthcare's Tina Verona. As COVID-19 cases increase in Connecticut, no doubt the people on the front lines of the effort are being challenged like never before. Joining me is Dr. Sharon Kiely, Chief Wellness Officer here at Hartford Healthcare. This conversation is not limited to employees of Hartford Healthcare. Everyone is coping with the emotions related to COVID-19. So, Doctor, thank you for joining us.
Oh, it's my pleasure. Thank you for having me.
And it's such an important topic. I want to start by talking about healthcare workers who are deeply entrenched on the front lines in this situation. We're talking about doctors, we're talking about nurses, medics, providers who are closest to the folks who are testing positive. What can you tell us about the possible anxiety that they might be feeling right now?
Sure. I think this is unprecedented, certainly in my career and in the careers of most of our healthcare workers at the current time. The things that they're thinking about are very basic. It's what we're worried about. They're worried about themselves, getting infected and not being able to work, which their work is really what drives them every single day, the passion that they have. And the other thing that they're worried about is are they possibly going to transmit this infection to someone else, maybe in their family. So those are two key things that they're very, very focused on.
And I think and as healthcare workers, you know, they're used to compartmentalizing sort of their feelings.
Yes.
Because it's taking care of the patient at hand and the task at hand, and then maybe it's dealing with those emotions a little bit later on. Is that the case here, or is it that they're going through these emotions while it's happening, or what exactly is the case here that they might be feeling in the present moment or after?
You know, one of our Hartford healthcare leadership behaviors is being in the moment, and I would say that that is one of the things that drives individuals in healthcare, be they a transporter, be they a physician, be a nurse, anyone. Being in the moment with that patient is what really drives the passion that they have. But at the same time, they have to be extremely careful. These are new procedures, putting on personal protective gear. They have to be trained to do that. This isn't something they've done every day prior to this. So they're learning at the same time they're delivering the care. But being in the moment is what's driving, I think, everybody.
And with Hartford Healthcare has a very strong emergency management. We prepare for incidents like this, for mass casualty situations, for incidents like this. We saw Ebola a few years ago. So the training that they do go through is pretty constant, it's pretty consistent, but you can never fully prepare for when it actually happens, right?
That's absolutely true. You know, the reality is that every patient that presents themselves to you is as unique as you are as a healthcare worker. And so it's that unique relationship, the worries that the patient has, perhaps their family has anxiety as well. And so these interactions are all unique. And we prepare for them, but until you're really in the trenches, you really can't know what you're going to feel as an individual. And that's what we're focused on right now to help the healthcare workers.
And you're really leading the efforts and providing that emotional and that physical support for our healthcare workers who are on the front lines. Let's talk about some of the ways that you're doing so.
Sure. We're communicating daily with the leaders of staff, the leaders of employees in the system, for ways that they can help to diminish the anxiety that their staff feel. Number one has to be communication. Everyone at Hartford Healthcare knows if they need a source of truth, they're to go to their supervisor, they're to go to their manager. And those types of questions are handled every single day. In addition to that, as this is evolving, that communication really takes on a very important role. So we've tried to systematize this through the organization. The second thing is to realize that people really do need a break, that you need to step away from your work for even a moment to just center yourself, get something to eat, hydrate yourself, and then come back to the bedside. Staff are now thinking about how they will work as a team in different ways given the unique aspects of this virus. And so it's evolving, but we're working as a team. We're communicating excessively, which is what is needed here. And we're also thinking about the future. What would the future needs be? And so staying basically ahead of that curve is our goal.
And you know, and it's working many long hours as we all are to deal with this. A lot of stressful situations. You have patients that are coming in that are very stressed. Healthcare workers can become stressful as well. How do you mitigate that stress and avoid potential burnout?
Well, that's a very good question and one that we're thinking of, and it's as unique as the individuals. It may be that having some downtime taking a walk or having some downtime listening to music, it's different for every single person. So we're encouraging people to find what works for them and to make time for it in their day. We're going to come out with a couple of other things that we're thinking about. We'd like to be evidence-based in this, as you understand. Thinking about what would be most effective to certain healthcare workers. For example, what works for an operative nurse might be very different than an ambulatory nurse, and we have to think about their different environments and give them opportunities that are unique to the work they're doing.
And speaking of unique, having someone like yourself as a chief wellness officer is not something that you see in many hospital systems. So we are extremely fortunate to have someone like you to sort of lead the charge and be there for our healthcare workers, because healthcare workers are there for everyone else. But to have somebody like you be there for them, I think is a vitally, critically important role.
Yes, I'm really honored. I think Hartford Healthcare is an innovator in so many ways, and this is a way that they were able to think about, the future of the healthcare workforce and the communities in which we serve. Some leading organizations also have chief wellness officers at the executive level, but I will say that we are really positioned with all our resources and all our terrific staff here to really lead and innovate. The individuals here that are interested in well-being and wellness of this health system are myriad, and so I have a tremendous number of resources at my disposal as well. I'm delighted to be here.
Well, we are so fortunate to have you, and I think it's important to remember as we go through these challenging, very uncertain, unprecedented times, as you mentioned, that it is a moment and it is a time that will pass, and we will all get through this together.
That's right.
So thank you again for joining us. We appreciate it. And thank you, of course, for watching. If you would like up-to-the-minute updates on COVID-19, sign up for text alerts by texting COVID-19, no hyphen or dash or space, to 31996. Online, please visit hartfordhealthcare.org/coronavirus. And if you have questions related to the virus, you can call the Hartford Healthcare Command Center toll-free 1-833-621-0600. That number, and folks available to answer that 24 hours, 7 days a week. So thank you again for watching. I'm Hartford Healthcare's Tina Verona. Stay healthy and be well.